Hey, what's up, y'all? Welcome to A Rose for Awareness. I'm sitting here with Dr. Politicos. He's a doctor at MSK, and he's going to give us a little understanding of what is MDS and give us a little further understanding about it, a little more about it. How you doing, Dr. Politicos?
Hi, Mr. Rose. Very well. I'm very happy to contribute some information to your channel, and I wanted to thank you for doing this awareness initiative.
Thank you.
Myelodysplastic syndrome is a disease of the stem cells that live in the bone marrow. Stem cells are responsible for making all the mature blood cells, including the red cells, the platelets, and the white cells. In some cases, the stem cells can acquire mutations or chromosomal abnormalities, and then they don't work properly. And in that case, they accumulate in the bone marrow, but they do not make all the mature blood cells in the peripheral blood. There are four common manifestations of myelodysplastic syndrome include low blood counts. So if the platelets drop, patients may have bruising or be prone to bleeding. If the white cells drop, they might be prone to infections. If the red cells drop, then they may have anemia, they may feel fatigued. Another risk with myelodysplastic syndrome is that over time it could evolve to acute leukemia if left untreated. That is when the number of the blasts in the bone marrow increases to above a threshold of 20%. Many patients ask, how did I get this, doctor? Like, is it something that I did wrong, or how did this happen? The truth is that there are very few well-known risk factors for diseases of the bone marrow. Those typically include exposure to high doses of radiation or other toxins, but in most cases we cannot identify a good or a definitive risk factor. It just so happens that while the stem cells proliferate and they create new stem cells, sometimes they acquire mutations or chromosomal abnormalities, and then they do not work properly. In terms of the management of the MDS, there are a few FDA-approved therapies. The largest category of those medications is what we call hypomethylating agents. These are treatments that are given typically in the outpatient setting, and they can help control the disease, meaning to reduce the number of the blasts in the bone marrow. Over time, they also have the chance to lead to improvements in the white cell count, the red cells, and the platelets. Unfortunately, these interventions are not curative, meaning they don't work in all patients, and when they work, there is a finite period of time that they will work for. So in those cases, we consider patients for a stem cell transplantation. That is the only potential treatment with a curative intent. And that involves giving high doses of chemotherapy or radiation to make room in the bone marrow and get rid of all the abnormal blasts and replace the blood-forming cells with healthy cells from a donor. It is a more involved procedure. It requires the patient to be admitted to the hospital, and especially in the early post-transplant period, patients require a lot of supportive care. They're more prone to infections and other complications of the transplant. But the goal is that over time, they will recover back to their usual health and that they will be free of disease. I would also like to provide some clarification on what we mean by stem cells and blasts. Stem cells are primitive blood-forming cells that they live in the bone marrow, which is within our large bones, and they have two properties. The first property is that they can self-renew, meaning they can make more of the same type of cells. And the second property is that they give rise to all the mature cells that we find in the peripheral blood, specifically the white cells and the white cell subtypes, the red cells and the platelets. These stem cells are also referred to as blasts, and healthy people have approximately 1 to 2%, sometimes up to 5% of blasts in their bone marrow. But when these cells acquire mutations or chromosomal abnormalities and they don't work properly, they can increase and be more than 5%, and if they go above 20%, that's when we call the disease acute leukemia. So when we refer to blasts, we oftentimes refer to the abnormal stem cells that are responsible for the diseases of the bone marrow. And these are the ones that we try to eliminate with the chemotherapy that we give before the transplant, so that the healthy stem cells from the donor can find room in the bone marrow and give rise to a new blood forming system.
So, quick question, Dr. Politicos. What is the procedure as far as a person finding a bone marrow transplant, as far as a donor? What is the procedure for that?
That is an excellent question. We try to find a perfect match for patients who are referred for a bone marrow transplantation. A perfectly matched donor could be a well-matched sibling. That would be the donor of choice for patients who have siblings who match them. Or we can look in the unrelated volunteer donor registry, and we try to find again well-matched donors. The likelihood of finding a well-matched donor depends very much on the ancestry of the patients. Northwestern Europeans tend to have the highest likelihood because the registry is very enriched for patients with that ancestry. Patients who are Southern European or Asian, Hispanic, Africans, they have lower likelihood of finding a well-matched donor. When a well-matched donor cannot be identified, we have the option of using half-matched related donors, which we also call haploidentical. We have the option of using cord blood that doesn't need to be well-matched, or a mismatched unrelated donor, which is the donor that we selected for Mr. Rose. With modern developments in the transplantation field, we can safely use any of those donors, and any patient who's referred for a transplant, for the most part, should be able to find a suitable donor to proceed with transplantation. The only difference is the platform, meaning how exactly we do the transplant based on the graft source.
Okay. So another question, Dr. Politicos. What is the recovery time if a person is able to find a donor?
The recovery time varies a little bit based on how we do the transplant and what graft sources we have available. For the most part, patients who are admitted for their transplant stay in the hospital for about 4 to 6 weeks. That includes about a week or so of administering the chemotherapy or radiation that we call conditioning regimen. This is to prepare the patient to accept the graft and also make room in the bone marrow. Then we do the stem cell infusion, and then it takes about anywhere between 2 and 4 weeks, depending on the stem cell source, for the donor cells to grow and give new white cells, red cells, and platelets. During the time, we support patients with blood products, hydration, anti-nausea medicines, antibiotics to prevent infections. So a lot of what we do in the first few weeks after the transplant is supportive care. We monitor patients closely because transplant is an invasive procedure, so patients do require close monitoring for complications. And then approximately 4 or 5 weeks after the transplant, they have recovered enough to be able to be discharged. We'll continue close follow-up during the early recovery period to monitor for opportunistic infections and other transplant complications. But over time, patients are usually able to recover slowly back to their baseline, and then they require less frequent visits, and especially when we're able to reduce the immunosuppression, their immune system has the chance to recover, which can take several months to have full recovery. But when that happens, they're able to get their vaccines back and lift some of the restrictions that we have early post-transplant.
Well, thank you so much, Dr. Politicos. I'd like to thank you and your staff personally. You guys have been awesome on this marathon that I'm going through right now. You've been really, what's the word I'm looking for here? Wow, you've been really great for the most part. Really great. You know what I mean? Your staff has really helped me out mentally and physically. And I recommend that anybody that's going through what I went through, MDS, to come by and make an appointment to talk to Dr. Politicos here at MSK and find out any more information that you need to find out.
You're very kind, Mr. Rose. I'm happy that you have had a positive experience, and I hope that we can achieve a successful outcome. And I'm very confident that Sloan Kettering has a good team of providers, and I also wanted to thank you for making this awareness initiative for other patients who go through life-threatening blood cancers.
Appreciate you, Doc.
I'm going to put this in the bag so we don't lose this.
Hey, what's up, y'all? Welcome to A Rose for Awareness. Glad y'all tuned in with me. Last month I talked to you guys. I was telling you I was up for a stem cell transplant. Today's my first day getting admitted. I started this morning I got here around 6:30, and by the time everything done, it was like 10 o'clock pretty much. And as far as I had to get a Catherine, something called a Catherine inside of me, basically, so it makes it easier, so they don't have to always go through the veins to draw blood or give me medicine, pretty much. Let me give you a little heads up of what it's gonna look like. Part of the shirt and stuff. I ain't got no t-shirt on, but this is pretty much it right there. It's like a line they cut through the top part right here, and it kind of goes down to your middle chest. I'm gonna post a picture of it, and these are the cords and different lines that they use to give me medicine, as far as medicine is concerned. Okay. This is the journey I'm gonna be on. I'm gonna be documenting it and having y'all go through it with me, so y'all can kind of see the process of, getting rid of this cancer that's in the bone marrow, which is blood cancer, pretty much. For those who don't know, that haven't watched my previous videos, it's called MDS, myelodysplastic syndrome. It is a form of blood cancer. And I've been going through this for about a year and some months now. A couple months, about 3 months, 4 months, something like that. I was fortunate enough and lucky enough to, by the blessings of God, to have got a donor. So, I'm going through the process now. This is my first day. They call it day 0. So and we got to go all the way up to 100. So just bear with me and stay tuned. Yes, I just wanted to give y'all guys a heads up of where we're gonna be staying at for the next 30 days or so. Just giving you a walk around through the bathroom because that's gonna be a very important part of me getting through this procedure. You know what I mean? It was brought to my attention that they gotta monitor my uses of my bowel movements as far as using the bathroom, as far as my urine and number two or whatever the case may be. Pretty much they gotta monitor to make sure everything is functioning correctly and making sure there's nothing abnormal that's going on, because when you do a surgery like this, you can have infections on the inside, and they pretty much won't know unless you give them the heads up on what's going on inside of your body, because you're getting new stem cells from another person. So that's a process alone in itself, because it's something called a graft versus host disease, pretty much, and it's your body accepting someone else's blood stem cells, and that can come with a lot of complications. It can react different as far as not accepting it, even though they have things in play that they can use to kind of like make that process more easy and comfortable. But those are just some of the things that they have to do as far as monitoring your stool movements and your urine. How many times a day you urine, is your bowel movements coming out watery, or is it hard, is it normal, things of that nature. Like I said, this is part of what I'm gonna be going through in here. I'm gonna keep y'all guys in tune, and there's a lot more got to be talked about. I actually got to do a chemo session tonight, which I'm gonna be doing chemo for I think about 5 or 6 days, and that's just to clear out all the the rest of the cancer cells that's inside of my bone marrow. So they have to give me aggressive chemo, stronger doses to pretty much knock out the rest of the cancer that's inside of my bone marrow. The thing about chemo, how chemo works is it kills everything. It kills the good cells and it kills the bad cells. So at the same time it's killing the cancer, it's also bringing down your immune system very, very low, which is very dangerous. And this is why they got to keep close eye on you as far as making sure you're okay, because your red blood cells, which give you oxygen, that's going to drop down low. Your platelets and your white cells, those are all things that stop your blood from clotting and stop you from getting infections. So those are like the main three things that they really got to watch out for and monitor you on your process and your journey going through this. But stay tuned. Keep y'all posted, and I'm gonna try to take y'all day for day and show y'all how what I'm going through and the process I gotta go through. It's not gonna be easy, but we're gonna get through it with the blessing of God. All right. This is a Rose for Awareness. Catch you on the next day. Peace. Yeah, hey, what's up, y'all? So, like I was saying, this was minus day 6. It's like a countdown until actually, we not actually do the transplant, and the days start adding on instead of dropping off, pretty much. I'm getting a shower today. I couldn't take a shower yesterday because I had to get the catheter put in. As you can see, very painful, uncomfortable to sleep with. For the most part, it's definitely needed though. It kind of alleviates, you're getting needles in your arms as far as when they have to, draw blood, which they have to do a lot, some more time, and just give you different medications, and it's easier when you have this many lines. I don't know if you can see it. It's this many lines connected to you, and it's kind of easy just to go in there and get it for the most part. But today I'm about to get another round of chemo. This is a different kind of chemo than from the one I had from yesterday. The one I had yesterday was pretty much, I had to eat ice for like an hour and a half, pretty much, which I was using the bathroom all night behind that one, but for like an hour and a half roughly, just so I don't get any mouth sores. That was one of the side effects of that particular chemo dose. So, I had to chew ice, like an hour, like a half an hour before, and like an hour, all through the hour I'm getting the chemo, I'm chewing ice and just sucking on the ice in general so that I don't get any mouth sores or any throat sores. They said that's gonna be kind of like, the common thing, and it kind of gets aggressive if you don't kind of like deal with it at the time. They said the ice kind of like soothes it, but this is for like later on down the line too as well, like when my levels drop, because when you're getting chemo, sometimes your levels go down afterwards. After the chemo, you start feeling sluggish. So for me, I'm gonna be doing chemo I started yesterday. That was my first day, and I will stop next week, Thursday, I believe, and I get a day to rest, and then they start the transplant actually to give me the new stem cells. That's the machine, don't mind that. But yeah, I'm about to get a shower in a little bit. Like I said, today's chemo, you kind of have to take a shower before and after, because this chemo kind of like, it comes out of your pores and make you sweat. So you can't keep that sweat on your pores when it's coming out. It's kind of like it'll give you like a rash or something in that manner. So I'm gonna have to take a shower before and after, like a couple hours afterwards. So when I'm getting the chemo, before I take that chemo, I gotta get in the shower, which I was gonna do anyway because it was time for this bandage to come off. I don't know if y'all can see it from yesterday. It's kind of bloody, so I gotta take a shower anyway. They're gonna change this, and then I'm gonna get the chemo, and then I think later on tonight I gotta take another shower after the chemo. I think the chemo is probably for no more than an hour, but it takes time to sweat out your pores. This specific chemo, so you know I gotta take a shower later on again, which is fine by me. Like I said, this is just a process, some things you gotta go through to get to the next step, next level. Keep fingers crossed and pray, definitely. Stay tuned, and I'll keep y'all posted on what's going on with me. So far, this thing right here is super uncomfortable, I'm not gonna lie. I'm in, so stay tuned. So I'm back, y'all. So I had to tell y'all again, my chemo was actually 4 hours. It wasn't an hour. It was like 4 hours. As y'all can see, I got my bandage changed. It's no longer looking bloody. I don't know if y'all could tell. It's no longer bloody, so yeah. Took a shower, feel fresh. Just took another shower actually because after the chemo was done, like I was telling you earlier, you gotta kind of like wash your pores off, like wash all that stuff off of your body, as far as that's coming out your pores. And I gotta take another shower tonight around 10 o'clock just to give it that final wash, make sure everything's good. It's a specific soap you gotta use, you know, while you're in this hospital, as far as, you know, going through what you, chemo or whatever the case may be, or having cancer. They want you to use a specific kind of soap, for like, so you don't catch any kind of infections or anything like that on the body, or anything that's coming out your pores. My next video, I'll show you guys the actual shampoo. I actually forgot the name of it. Yeah, so, you know, it's just another day right now, just sitting back waiting, you know. How am I feeling right now? I feel pretty good, you know, for the most part. I don't feel stressed out about nothing. I haven't had any real crazy side effects. Not to say they're not gonna come later on down the line, but for the most part right now, it's okay. You know, just taking one day at a time. Stay positive, and pray for the most part. Mostly I do, I actually had to get up today and walk around. They actually want you to do like a mile a day, if possible. You know what I'm saying? Cause going through this type of surgery, or going through this kind of specific transplant, you know, being that you're taking chemo, aggressive chemo is gonna weigh your body down. You're gonna have days where I'm not gonna want to do nothing pretty much, but you know, you gotta build your strength back up by at least moving around and trying to get your immune system and everything pumping again, you know. So today I walked around the building, around this large lobby. I'm probably gonna show y'all next time I go out there. And did like a half a mile, you know, since it was my first day. And they had like a physical trainer that come through and kind of help you and guide you towards, you know, try to get your strength back up. Even though they know you're gonna have your days where you're not gonna want to do nothing, probably lay in the bed, you know, which is understandable, you know. Like I said, this is a journey. Just bear with me. This is like I said, -6. And we're counting down all the way up to 100. So this is, like I said, it's a process. And I'm glad y'all here with me to take this journey with me. Alright, stay tuned. Peace. Hey, what's up, y'all? So
My minus day 6 and day 5 has been kind of crazy. Um, Pretty much I've been in the bed off for the most part due to diarrhea. Really haven't have an appetite. When I started off, I was 255. The mix of a couple of days, I dropped down to like 236. That's been because I haven't been eating correctly. Because of the nauseousness, and they have to give me different medications every time to try to make the nauseousness not as strong, and help me to be able to eat certain things. But for the most part, day 5 and day 6, I just been bedbound. I got up and did my little walking and stuff like that, just to keep my body as active as possible. But the nauseousness is really it's overwhelming, and it's definitely stop you from wanting to drink and eat anything. You know what I mean? The fear of throwing up. You kind of wish you just really did just throw up and call it a day, because 9 times out of 10 when you throw up, it feels a lot better. You could probably really eat and function, than opposed to you just having that constant throw up feeling like you just ready to throw up everything, but it's not there. But they've been working with me, giving me different medicines for the most part. It's been somewhat under control, but my eating habits ain't been the same in the last couple of days, so that's why I haven't been recording anything or whatever the case may be. But I'm still bedbound. I'm still having the same discomfort as far as smelling food and be able to taste certain foods, and that's just probably making me lose most of the weight for the most part, because I'm not really eating the correct way. But I'm getting a lot of fluids in me every day, so I'm staying strong behind that one. Like I said, this process is still a process, nevertheless. I'm feeling fine about everything moving forward. It's just one day at a time. So today was my last day of chemo, and they're gonna give me a day of rest tomorrow. I don't get no chemo and anything like that. I'm just gonna be, if anything, getting like the fluids and stuff that I need, and still taking my medications. And Friday, we're gonna start with the transplant. Hopefully I should be well enough to take you guys through that. Like I said, minus day 6 and day 5 has been kind of rough. It's pretty much bedbound for the most part, and really couldn't do nothing. So that's why I haven't really shot any video or anything like that. But I'll be alright. I'm gonna bounce back. Pushing through this. I gotta do walk around the facility on this floor every day, 14 miles. They kind of want you to, do at least 14, or half of 14, at least half of a mile, to just keep your body functioning and stuff like that. You know what I'm saying? So you just want, because the bed will make you definitely sleepy. Take it from me. I've been in and out this bed for the last couple of days, and it's been draining me. So, believe it or not, the walk around the floor is just, it's a big difference. You know what I'm saying? So it kind of helps your energy and help you, be able to move forward. So, just some of the journeys I gotta go through. Like I said, hopefully this video finds somebody that that's going through the same thing, or about to go through the same thing, and maybe this can shed some light on this situation, and let them have an idea of what they're going to be going up against. Like I said, I'll keep y'all posted. Just bear with me. These last 2 days been kind of brutal for me, as far as dealing with nausea and stuff like that. So I'm gonna see y'all next go around. Peace.
Hey, what's up, y'all? Just giving y'all a little brief update of what's been going on with me. So after the transplant that I had, which was the other day, pretty much it was through the catheter that I have. I don't know if you can see it a little bit. Let's see if I can make the camera go. So basically, it went through there, and it was injected to my body, pretty much where the cells will, find its way towards the bone marrow, and make its way towards the bone marrow, pretty much. It wasn't an aggressive procedure, which I thought it was gonna be. That's why I also, urge people to go out there and donate, because the procedure is not as bad as what you think it is. You know what I mean? It actually can save someone's life in the process. Not to get off topic or anything. Pretty much how that works is they would inject the cells from your arm, and the process probably take about 3-4 hours. So it goes through this machine. It goes through your veins. It goes in this machine, and the machine takes out the cells and cleans it and put it back into your other vein, into your other arm, the other arm, basically, pretty much. Procedure is not aggressive at all, and like I said, it could definitely help save a life. About to say something. So, it's a shot that they give you normally in your underarm, like at the I want to say this a little bit underneath your arm, right? It's a shot that they give you. Pretty much it's like a TB shot. I don't know if you ever got a TB shot before. It's kind of like that, and they give it to you for 5 days, and it actually brings up the cells that's needed out of the bone marrow, and it just lingers in the body until their time to eject it out of you, pretty much. Trust me, it sounds abrasive, but the procedure is not abrasive. You know what I mean? Like I said, it could save someone's life at the end of the day, and it's something to make you feel good about yourself, man. You know what I mean? To know that you can actually help, someone save their life and be a part of that whole process. You know what I'm saying? I know I'm kind of all over the place with it right now. Just bear with me. So going through what I've been going through, I've been really sick after the stem cell transplant. As far as my hair, I had to cut all my hair off. I was losing my hair. I had braids before. I don't know if you had noticed the process. I'm still actually losing hair, actually. What else? Oh, I caught a stomach infection from taking the medicine that I was needed to actually help me after the transplant. I caught an infection from that. Which they got medicine and stuff that can fix that up 1, 2, 3. It's not nothing. Trust me, it's not nothing that they can't give you medicine to fix. You know what I mean? That's the easy part. You know what I mean? Once the cells is somewhat accepted to your body, everything else they got medicine and they got an idea or a clue somewhat to fix the process. Like for me right now, I'm going through a bad case of like I said, I caught a stomach infection. I have a bad case of diarrhea, which they gave me something to slow it down. Now it's just trying to, get rid of the infection now on top of it. I lost my sense of appetite as far as eating and stuff like that. I can't eat nothing that's on this hospital menu right now. Like everything I gotta eat is pretty much from home. My wife or my son brought it to me. You know what I mean? I eat my appetizer consists of oodles and noodles and fruit cocktails. The little fruit bowls. That's the only thing I can eat right now, besides home cooked food that they bring for me to eat. I went from eating the food on the menu, which wasn't bad in the beginning, but after I caught the stomach infection, I could not eat the hospital food no more. Nothing on the menu. Everything smelled nasty to me. Yes, and MSK has some pretty decent food, to be honest with you, for hospital food, to be honest. But just for me, I guess, like I said, my stomach just doesn't agree with the smell of the food no more. So I kind of can't eat no hospital food right now. John and G was drinking water. I don't have the taste for water right now. That's how bad one of the side effects is from the chemo afterwards. They kind of took away my sense of smell, and gave me diarrhea, a bad case of diarrhea. Yeah, but for the most part, I talked to the doctor. Everything is still on schedule. Everything is still where it needs to be at. It's just a process you got to go through, to get to the other end. You know what I mean? And I'm here for the journey, of course. Please, people, go out there and donate. Go out there and help somebody. Go out there and save a life, man. And it costs you a couple hours out your day, a couple of stem cells that you're gonna regenerate right back. You know what I mean? Please go out there and donate, man. Please go out there and help save someone's lives. Hit up beatthematch.com. It's another website I gotta get y'all to that also plays a part in finding donors as well. But please hit up Beat a Match and try to help go out there and donate, save someone alive, man. And this blood cancer is really serious, man. You know what I mean? It's not a game. It takes lives. You know what I'm saying? So please, I ask you, if you follow me and you like the content I've been putting out, just go out there and donate. Help become a donor. Help try to save someone alive. Alright? I'm going to keep y'all posted on my journey while I'm still in the hospital. I just wanted to give y'all a brief update of what's been going on with me. This journey has been crazy, like I said, man. I can't get released from the hospital until my white cells is up. Right now, my white cells are still low. If you don't know what white cells is your immune system to fight off any kind of infections and anything like that. Your platelets is what helps your blood from clotting. Like if you get a cut, you won't bleed out. And your red cells is what brings oxygen through your brain and just help you in general to function, period. So these are all things that my body needs to recuperate before I can leave the hospital. Well, for the most part, the white cells, you can go home after the white cells build up, but everything else can gradually go up eventually and sustain itself on its own eventually. But they want to see at least your white cell, your immune system, because that's what's gonna fight off any of those infections. Alright, so please stay tuned with me. I'll keep y'all posted. I apologize. I haven't posted in a couple days because I've been out of it. I ain't gonna lie to you. Like, the stomach virus been kind of kicking me down a little bit, and the chemo it's just been real aggressive, Stay tuned. This is a Rose for Awareness. I know the motto. Peace. Hey, what's up, y'all? I know I haven't did a little vlog in a minute as far as since I've been in here, man, but I had my up and down days since I've been in here as far as going through this journey with this chemo. Well, so far everything's been successful as far as the transplant went. My body's accepted the new donor cells, and accepting the new donor cells come with side effects, of course. I had a taste of the graft versus host. I didn't experience a lot of the side effects as most people. I had a skin rash that I'm going through right now, as far as on my back, my body, my legs. That came from the graft versus host. If you don't know what graft versus host is meaning the cells that was donated to me, and that's now in my bone marrow, that's reproducing, is like allergic reaction, pretty much, because it's new to the bone marrow, my bone marrow at least, and it's kicking off a side effects because it's not known, where exactly it's at, meaning it's foreign to them. So it's like somebody walking in your house and you're looking like, okay, what's going on? Who is this person? Where you come from? It's kind of something like that. So, but for the most part, they have stuff for that.